Good afternoon, everyone, and thank you so much for joining us for this virtual meeting here on WebEx. We really want to say, first off, we appreciate your service to the city, your sacrifice and your commitment. Thank you so much. I'm Rick Journey. I serve as Director of Communications for the Mayor's Office of Public Information. I will serve as a moderator during this meeting today. This kind of continues something we've been doing for the last few weeks. Since the pandemic began, since the city faced this crisis, we have communicated with more than 20,000 people. Many of you on this line have been on the line with us for teletown halls in the past. We have the text messaging system through Everbridge, where you text BHM COVID to 888-777. More than 15,000 people have signed up for that. All of this designed to stay connected during this time of crisis. So we thank you for taking part today, and we thank you for all that you do. A couple of things before we begin the program. If you are viewing this online, you are able to ask your question in the Q&A section of WebEx. So if you're online with this, you will be able to ask your questions in the Q&A section of WebEx. It should be on the right-hand side, kind of the lower right-hand corner of your WebEx screen. If you're listening by phone, you can text your question. We've got two numbers in which you can text to, 205-807-8231. Let me repeat that one again, 205-807-8231. Text questions there. We have another text line for you, 205-335-2348. Again, 205-335-2348. That will be an opportunity for you to text questions if you're listening by phone. The WebEx meeting is being recorded. We hope to post this as soon as possible on the birminghamal.gov/COVID policy. That's, once again, it's the one word, COVID policy, COVID-POLICY. That is a location where you get all of your resources as city employees, as far as executive orders concerning this, as far as the teletown halls of the past, and this virtual meeting. You can find that material. You will hear about other initiatives today in which you will be able to find more information on it at birminghamal.gov/COVID policy. With that, let me take a moment now and remind you once again to start asking your questions. One thing I just remembered, please note that we will be asking you some questions. If you are on the online portal for WebEx, we will be able to poll you and ask some questions during this. I'll let you know how to do that when we get to that moment. But with that, let me take the time now to introduce Mayor Randall Elwood.
Hey, good afternoon, and thank you, Rick. Let me also say thank you to everybody that's listening in and watching this. You know, it's been a couple of weeks since we last spoke. This morning, I had a chance to speak with other city employees, many of whom will be coming back to work for the first time in many weeks. But police and fire professionals, you all know that the city never did close. More than 2,500 city employees have been working throughout this crisis for 2 full months. You have been steadfast, very diligent and unwavering in your efforts to the city of Birmingham, and I am very appreciative. All of our employees and our residents owe you our gratitude, not just for you doing your job, but for doing it with the spirit of service. Now, many of you all went way above and beyond. And there are many examples, such as Birmingham Police Officer Jeanette Prince, who saw residents on her beat in need and purchased food for them out of her own pocket. There were DPW workers like DeMarco Beck and his crewmates, Donnie Brock, Michael Gamble, as well as Charles Bush, who simply said, and I quote, "The work is going to have to get done. I still want our city to look good, and I want to practice safety because of the coronavirus." And there are many, many more examples of our employees, you all, going above and beyond to take care of each other and our residents. And so today, we're going to be addressing many of the questions exclusively for police and fire, but I want to start with the basics. The COVID-19 crisis is a public health crisis. The operative word here is health. So I want to remind you of what we've done to protect you and all of our employees. We placed sanitizer stations throughout city buildings including elevators and hallways. We have propped open frequently used office doors, and we have directed Public Works to take extra measures to clean light switches, elevator buttons, door handles throughout the day, every single day. We've also provided all department heads with face coverings for employees to have upon their return, and many departments have already been provided substantial PPE resources over the past few weeks. And finally, we have completed weekly cleanings, deep cleanings of all buildings open to the public. Now, we've taken every measure possible to keep our employees safe. Even with 2,500 employees we've had working, only 6 of those cases have been COVID-19 related for our employees. 4 of those employees remain quarantined and 2 have fully recovered and returned to work. Our measures are extensive, and we've proven in 2 months, 8 full weeks, that they can work if we will embrace them. Now, you've managed to stay safe all of this time. 8 weeks is long enough to build some good habits. Now the public and our coworkers will enter more of our spaces. We need you to help model good behavior to keep your family and our city safe. Now, many of you want to hear how are we going to handle many things related to the city's full return on May 18th. But before we do that, I want to say one more thing. If you haven't heard me say it yet, I am aggressive about asking for data to support many of our decisions. Our decisions to shut the city down was based on public health data. Our decisions to put forth a curfew and face coverings ordinance was based on public health data. However, the state's decision to open Alabama was clearly not based on public health data, but on other factors. That decision has many consequences for all of us, especially our small businesses and workers, many of whom are returning to work and attempting to find their new normal. As our residents and businesses re-engage our city, we need to remember that the rest of our team has to come back to work because we need everyone to serve our residents. Our residents have not stopped paying taxes. I think that's worth repeating. Our residents have not stopped paying taxes, and as their demands increases, our 2,500 employees who have been working every day, which is you all, that have been shouldering the load, you all, for the rest of us, deserve to have a fully productive workforce. That's why we need everyone back and fully engaged. And for our residents, for our coworkers, for our city, this is the data that drives my decision. With that in mind, I've asked several members of my leadership team to join me and help address a number of issues. First, I'd like to invite our Chief of Staff, Cedric Sparks, and Chief of Operations, Kevin Moore, to share an update on return to work protocols. At this time, Chief of Staff, Cedric Sparks. Thank you.
Thank you, Mr. Mayor, and good afternoon, members of the Birmingham Fire and Rescue Service and members of the Birmingham Police Department. As the Mayor has noted, you all have been a shining example of what we look forward to our employees who are returning. You've been a shining example of the type of service we look to provide our citizens. We want to thank you for epitomizing our mission, our theme, and our core values, because not only have you done it prior to us entering into this pandemic, you've done it while we've been in it, and we're still looking forward to you providing that level of service once our employees return full force on May the 18th. So just as a reminder, we're still about the business of putting people first. That's both internal and external. And again, you've epitomized that. The mayor has noted that we've held you up as an example of what we look forward to all of our employees doing upon their return. We still believe in building community through servant leadership. The mayor has noted several of you have represented us to the highest level in our community, not only protecting and serving us, but also representing service to the highest level. And then epitomizing our core values, customer service. Although you have the job of protecting us, you've done so with a spirit of excellence, efficiency, effectiveness, transparency, and accountability. Those are still the orders of the day. And again, we thank you for what you have done, and we look forward to your continued service of upholding our mission, theme, and core values once we're full force when employees return on Monday. Also, I want to share with you what the plan is regarding our facilities. There are many questions regarding the facilities and spaces that the city is responsible for. We've broken down how we are going to move forward with our facilities in 3 buckets. The first bucket is for our employees who are returning. So in spaces like Park and Rec, Library, Sloss, Museum of Art, Boutwell, the Negro Southern League Museum, Arlington, and the Crossplex, our employees are returning, and their return does not necessarily speak to whether the facility is open or closed. So when you hear us saying the employees are returning on Monday, that's the employees returning on Monday. When we move to phase 2, or the other bucket of our facilities being open or closed, that's the engagement with regards to the public. If the public is actually able to utilize that space. That decision has not yet been made on when it would be available to the public. You've heard the mayor note this. We are focusing on data, not dates. So although the employees are returning, the spaces that our citizens will be engaging in are not yet open back to the public. For our facilities, we have a few that have boards that will be making recommendations on when the space will be safe for us to re-engage citizens. We're using best practices from around the country for many of their peers to determine when it's safe for our employees as well as the citizens. But phase 2, or bucket number 2, with regards to our facilities, is to allow the public to come in and patronize. That decision has not been made yet. Bucket number 3, with regards to our facilities, we call it small, medium, large. The small version is there are some of our facilities that will allow meetings that are in compliance with our gathering numbers. So small size meetings may be allowed, small gatherings may be allowed in some of our spaces as long as they comply. Move to medium, you may hear of either wedding requests or smaller events that still fit within the gathering guidelines, the social distancing guidelines. Many of our facilities will make decisions on a case-by-case basis. However, large-scale events like concerts, big weddings, events like that, those events have not been cleared yet. Obviously, again, those will be done on a case-by-case basis. If they can effectively show whether they can comply with social distancing guidelines and keep folks safe, but the decision on reopening to allow those activities have not been made yet. So for our public safety, because many of you will be requested to come out and serve in those, our decision for facility is on Monday, our employees will return. That's bucket number 1. Bucket number 2 is allowing for the public to engage in those facilities, and take part in those facilities. That decision has not been made yet. We will use data over dates. Bucket number 3 are the utilization of those facilities broken down to small, medium, large. Small events may be both internal and external. Departments using those facilities as well as external requests. If they're small, social distancing can be allowed. Mask, facial coverings cooperation is done. We may allow those. Mid-size, again, it's a case-by-case basis. And then large-size events, we have not cleared those. The respective department leadership and boards for those individual departments will make decisions, and we'll try to do so on a uniform basis so that you all don't have to guess. The third thing that I'll touch on is temperature checks. There have been a lot of inquiries about how we will screen for employees as they return back to work. And we, again, have tried numerous different approaches to make sure that we keep our employees, keep you all, keep citizens in safe space. And what we've settled on to make sure that we're as efficient as possible is random temp checks. Per the CEC, there's so many different symptoms and signs that can be used to determine whether or not a person has COVID-19, that we thought the most effective way to do it would be to do random temp checks. And so we will have our security detail, our security guards, daily do random temperature checks around the city every single day. And again, there's no end date for when we'll stop because we're using data over dates. So please look forward to random checks every day throughout the day, various city departments, various city facilities, to make sure we can do as much as possible to keep us informed with information. Once we find out if an employee has a temperature spike, then our HR department will take over the process, and we do have systems in place to ensure that an employee that may have a spiked temp, that we can walk out the next steps. So I'll invite Chief Kevin Moore, our Chief of Operations, to come up to give you some of our operations updates. And then following Chief Moore, we'll bring up Ms. Jill Madizik and also Mayor Woodfin to provide additional updates.
Before Chief Moore speaks, we do have a poll question we're going to begin with. Before Chief Moore speaks, we're going to ask you a question. If you are online on this conference, you will be able to answer this question. If you're not online, you will not be. If you're on your phone, you will not be able to answer this question. Our first question for you: over the past 8 weeks, have you received sufficient updates from your department head on the city's efforts to address the COVID-19 crisis? The answers are A, yes, B, no, C, unsure. Again, I'll ask the question. Over the past 8 weeks, have you received sufficient updates from your department head on the city's efforts to address the COVID-19 crisis? A for yes, B for no, C for unsure. You should see that in your lower right-hand screen on the WebEx page, and you will be able to answer that question. We'll give you a few minutes to answer that question, and now we will continue with our presentation from Chief of Operations, Kevin Moore.
Good afternoon. It's definitely a pleasure to be talking to the Birmingham Police and Fire staff today, and just wanted to give you a couple operational updates. I'm going to talk about 3 specific items. 1 is face coverings, 2 is cleaning up facilities, and 3 are the elevators. Relative to face covers, Executive Order 8720, Section B1M, basically states that all the employees are required to wear face coverings while at work or at city facilities. Therefore, we have provided face coverings for all the department heads to distribute to staff. Additionally, because of the nature of the work of police and fire, we've also made sure that we have ensured that there are a proper number of PPE face coverings at our warehouse. So all departments should have the adequate resources they need to address their daily activities relative to protecting them against the citizens. The second item we want to discuss is cleaning up facilities. We have provided a contractor who has been going out cleaning the police headquarters as well as the 4 precincts. We continue to move forward with that process, and once that contract ends, Public Works will begin to provide those resources and that ability to disinfect and sanitize those facilities. And the final item we want to discuss are the elevators. Due to the confined space of the elevators, we're going to move forward to restrict the amount of people in elevators to 4 people per elevator. And when you can't get on an elevator, we also encourage you to also use the stairs. Now, this time we're going to bring up Ms. Jill Madizik, who will bring some additional updates relative to personnel issues.
Good afternoon. Thank you for your continued service to the cities. You all should have received by email a copy of the revised executive order, which implements most of the items that were referenced by Chief Sparks and Chief Moore. It does re-emphasize that employees must have face coverings when they are at work. It also makes each employee, when they appear at work each day, are self-certifying that they do not currently have COVID-19 and that they're not exhibiting any of the symptoms. If you do report to work and you feel that you have symptoms, you need to reach out to HR and we will help you, direct you to the appropriate area for testing and to determine what next steps are. It also requires that if you or a member of your household has an order of self-quarantine, that you should notify HR so that we can make appropriate steps for the leave that would be necessary during that period of time. Also want to remind you that none of your supervisors are allowed to send you home because of purported having symptoms related to COVID-19. They need to reach out to the department director who will reach out to HR. I do want to address leave and talk about FMLA. Questions have been raised as to why FMLA is not available for police officers and for firefighters. The main reason that is because those are essential positions for which we cannot operate on a day-to-day basis without. Now, if a firefighter or a police officer has an underlying health issue that stops them from being able to work, they are entitled to reach out and seek FMLA. Upon proper medical documentation, you will be provided leave for FMLA, which will provide the protections that are available to you. Additionally, if any of our employees, whether they're police, fire, or otherwise, should contract COVID-19, all of those employees are entitled to 2 weeks, 80 hours of paid leave. At this time, I will turn it back over to Chief Sparks.
Thank you, Ms. Jill. One of the items that the mayor challenged us was doing is providing support options for all of our city employees, but especially our police and fire. One of the services that we'll be offering is what's called a May Day Camp. In addition to some of our community partners who have stepped forward to provide childcare support for our essential employees, especially police and fire, the city will be offering for the next 2 weeks a May Day Camp. It's only for city employees, children of city employees ages 5 through 16. And a part of the reason why we are offering for the first 2 weeks, or the last 2 weeks of May, is because we know that young people are still doing online learning via their school. So our May Day Camp will be offered at the Crossplex and at the Bowell Auditorium. Again, it's for children of city employees only. There will be support provided to assist them with their schoolwork and also to provide them with enrichment activities as well. The program will be facilitated by our Mayor's Office Division of Youth Services, as well as the Birmingham Park and Recreation Board. So you'll be able to go to the city's website, www.birminghamal.gov, to find more information, or you can contact DYS or the Park Board for more info as well. But again, this is one of the options that we are presenting to make sure that you have support in spaces for your children ages 5 through 16. In terms of childcare options for children under the age of 5, we are also partnering with, again, various community partners for smaller children. You can reach out to the Department of Human Resources for the listing of those community partners that have agreed to provide childcare support for city employees during this critical time. We will reevaluate after the month of May to see if we will extend our May Day Camp to ensure that we provide every option possible to support all of our employees as they return back to work to serve our citizens. I now plan to Rick Journey, who will also do questions and also bring Mayor Whitman back up.
Thank you, Chief Sparks. We're closing out the current poll question. Just to let you know, we're closing out the current poll question. We have another question for you right now. And just a reminder, if you're listening on the phone and you have and you're also looking at the WebEx app, you can answer those questions. But if you're listening on the phone only and don't have access to the WebEx app, then you won't be able to answer this question. But everybody online will be able to. Our next question, do you have sufficient PPE to do your job? A for yes, B for no. Once again, do you have sufficient PPE to do your job? A for yes, B for no. We'll give you a few minutes to answer that question. We'll ask another one momentarily. While we're doing that, I also want to remind folks once again, a couple of ways you can ask questions today. If you are viewing this online through the WebEx portal, you're going to be able to ask your question in the Q&A box that's on the lower right side of the WebEx portal. If you're listening by phone, you can text your question. There are 2 numbers you can text, either 205-807-8231 or 205-335-2348. Be encouraged to text those questions if you are not on the WebEx portal, and we would put them into the system. We will now go to the questions for the mayor and the executive leadership as well. The first question kind of deals with within the buildings of water fountains. Will the city turn off water fountains, dealing with particularly in the building, and could the city encourage employees to bring their own bottled water?
Very, very good question. And our operations team Our Chief of Operations is working very, very closely with our Public Works Department. So to the first part, water fountains in the parks have been turned off. We will be turning off water fountains within the buildings. Again, just to do as much as we possibly can to control community spread. And yes, we do encourage employees, we always encourage employees to bring their own water bottles or their own supplies, utensils, just to eliminate the sharing of those things. So yes, we have already turned off water fountains in the parks. We will be turning off water fountains in the building. And yes, we do encourage and will continue to encourage employees to bring their own water bottles and other supplies. Very good question.
All right, Chief Sparks. Our next question, just give me one moment. This deals with the COLA increase. When will we receive the 1% pay increase?
What did you say, Jim?
It started 4/24.
All right, you should have received that, starting April 24th. So that's already, that's already a part of your pay.
Mayor, the next question, the Records Division of the Police Department would like to know why they are the only division yet to receive hazard pay while working with the public on a daily basis.
So I've had the opportunity actually to visit various fire stations and police stations, as well as the Birmingham Police Headquarters back in the month of April. I had a chance to visit records, and I had a chance to speak directly with some of the employees. And as I've shared with some of those employees then, as I'll state now in front of everybody, two things. Hazard pay was based on employees coming into frequent contact, direct contact with the public on a frequent basis. That decision was determined not by the mayor's office. That decision wasn't made here on the third floor. That was not a political decision. That decision was rooted at the department head level for them to engage and assess their employees based on the type of work they did. As I understand it, a request was made to that department. I'm not sure where it is as far as being filtered up from a protocol standpoint, but I will commit to you this. When this meeting is over, I will reach out to that department head and inquire about that division within the department, and if and when or why or wherever that is, why they have not received it, and or if they will receive it, so communication can be given to you so you can know where we are in this situation.
Mayor, another question on the same topic. Why did Birmingham only receive or allot $500,000 for hazard pay, which ended up being $82 for me, when some cities around the country are providing more?
I can't speak to other cities. And I hope in taking that into consideration, you consider a lot of cities didn't do hazard pay. So I hope this person, whoever asked this question, is appreciative of what the city was attempting to do. But let me answer the question. We offered that $500,000 because that's all we had. If we had more, we would provide more. And if we didn't have anything, it would have hurt not to provide anything. So I hope our employees are appreciative and grateful of what little bit we could do to provide some relief.
Mayor, the next question, will retirement buyout be considered in the near future?
That is an option on the table. As I've stated with many employees this morning, as we consider the health crisis that caused an economic crisis, and now an economic crisis that has also caused a possible financial crisis, we think about the city of Birmingham, and for every dollar that comes in, 80 cents of it is based on business licenses, sales tax, and occupational taxes, and use taxes, and lodging taxes. We know some businesses have closed and won't reopen, so we'll never see their business license again. We'll never see those sales taxes again and those occupational taxes again. We know events are not happening so in our city, and so people aren't staying in our hotels. So we're not receiving the lodging taxes we usually would have. That was 2 weeks in March. That's all of April. And even with things easing up in May, we still know certain parts of town, up to 50, 60% of businesses are still closed. So we don't know how May will look. Saying all that to say this, that's 80 cents of every dollar that comes in. 70 cents of every dollar that goes out is for our employees. Again, 70 cents of every dollar that goes out of the city is for our employees. That includes base salary, COLA, merit, longevity, insurance, pension. And then you have some other things that are included in that. When we consider all of this, I will tell you the break glass here, the things we don't want to do. We don't want to terminate anyone. We don't want to furlough anyone. We don't want to have anyone receive pay cuts. Again, that's break glass here if we are in just financial straits. Over here is one priority. That is to keep every employee employed. Again, one priority is to keep every employee employed. In that regard, we're looking at everything we can within this budget to make sure we're keeping that one thing in mind, that priority, keeping you employed. There are other things over here we'll have to consider. We haven't made a decision on. We are not in the position to make a decision on. The Mayor Council Act states that the mayor's office is supposed to submit to the council the 20th of every May, the actual proposed budget. I just shared with the council this morning by phone and email that for the first time, I'm not sure how long, the city of Birmingham, the mayor's office will not be submitting a budget to the council and next week, May 20th. And so we need to have everything on the table, what we can or cannot do. And some form of a retirement buyout is an option we can consider, but that decision has not been made.
Thank you, Mayor. Before we ask the next question, I want to ask a question to those participants on WebEx. Our next question, as we close out the current question about PPE, our next question, if you have children, what are their age ranges? If you have children, what are their age ranges? A, 0 to 5, B, 6 to 14, C, 15 to 18 years, and D, 19 or older. Please answer that question, and then I'll turn to our next question. Why are firefighters and law enforcement officers excluded from emergency sick leave and FMLA in the new mayor's executive order?
To answer that question, I will break it into the two items from the emergency sick leave provision. If you look in the executive order, provisions have been made that mirror federal law relating to the emergency sick leave and individuals' own illness. So under the executive order, law enforcement officers and firefighters, if they contract COVID-19, will receive 80 hours of paid sick leave, which is the equivalent of what the emergency sick leave provided under the Federal Act. Relating to the expanded FMLA deals specifically with the ability to care for children as a result of schools and daycares being closed. As you all know, police and fire are 7-day, 24-hour, 365-day jobs. Just as when it comes to shift bidding, you cannot change your shift as a result of a lack of childcare or some change in circumstances at your house. And during that bid process, if you end up having to change your shift because you have children at home, does not allow you to refuse to take that shift. That is why police officers and firefighters were excluded from the expanded FMLA.
Next question deals with hazard pay. Why are people that are not frontline emergency workers receiving hazard pay? An example, senior arborists.
The answer to that question is based on the type of work that employee or that employee group does. There's no actual contact or consistent contact with actual the public. Many people have frontline jobs. However, your frontline job may put you in a situation where you haven't had to actually engage the public. You haven't had to engage citizens and residents in our city. Therefore, you wouldn't qualify for hazard pay.
For the few senior citizens, 65 and older, or those who have underlying illnesses, is it safe for them to return on the 18th?
So that question, there are many ways to answer that question. I'll have my chief of staff expound on the answer I'm going to give you. We need to remember that there's every employee is not the same. There are individual assessments for each individual employee. And I would say that the conversation between your immediate supervisor and or department head, definitely with HR, puts you in the position to have a more nuanced, intimate, detailed conversation outside of this purview that allows that particular individual situation to be assessed. I'll let my chief of staff add on to that.
Thank you, Mr. Mayor. So there are two things. While we have seen in many cases that people ages 65 and older are susceptible, what we've also learned is that it's not limited to age. So we're focused also on more of the underlying health issues. So regardless of the age, we certainly want those employees who have underlying health issues to share that with HR. The greatest amount of care will go into making certain that people's healthcare information remains confidential, and we will make determinations in terms of what the appropriate next steps are for all of our employees who have underlying health issues effective May the 18th on their return, and how their employment situation looks beyond that. So I want to make sure that we're clear across the board, regardless of the age, if there are underlying health issues, we would like for those to be lifted up so we can make sure we keep you in the best space possible.
Thank you. Our next question, how many city employees have been diagnosed with COVID-19?
Six employees have been diagnosed with the COVID-19 in between the time period we've been under this health crisis. 4 of them have been, quarantined? Yeah, 4 have been quarantined and 2 have been able to return to work.
Thank you. Our next question, why random temperature checks? Why not just do daily checks before clocking in? And what if we refuse to have our temperature taken?
So that's a very fair question. So it's a couple of layers to this answer. So for Birmingham Fire and Rescue and BPD, you all are actually equipped to do more regular temperature checks because of the subject matter expertise that you provide. For our other city departments, city facilities, they're not equipped with the same level of expertise, and quite frankly, to do a temperature check for each employee at each facility at the time that they arrive to work would require a different level of expertise at that individual site. So we feel that for the remaining city employees, and again, we've talked about this over and over again, for the remaining city employees, random checks are better, and we'll be doing those throughout the day. Again, there's no end time that we look to do it, so that all employees, first of all, self-check. So we're asking in this instance for employees to take the first step themselves while they're at home, take their temperature. Please don't do anything to alter your temperature upon your arrival. And then be aware that we will be doing random checks. And we're hopeful that the random checks put people on notice that we're going to do our best to make sure that we're protecting the employee and the rest of our employees from employees that may show spiked fevers. But for Birmingham Fire and Rescue, spiked temperatures, I'm sorry, but for Birmingham Fire and Rescue, you have expertise, and so your leadership team may increase the amount of checks that you're doing. They may take a different approach because you have the expertise. The other piece to that is what happens if someone is not willing to have their temperature checked. So we've spoken to this, and we would ask for all of our employees that they don't think that way. A part of the reason that we're doing temperature checks, and temperature checks are only one sign of a myriad of reasons that a person could be ill. All right, so a part of what the CDC has noted is that in the last 2 weeks, we've had at least 6 new signs and symptoms that an employee could exhibit. So temperature checks are only one. However, if an employee willingly refuses to have their temperature checked, it also places all of our other employees at risk. And the mayor has noted this. We're all in this together. So the steps that we're taking, facial coverings, social distancing, making sure that we do temperature checks, it's meant to keep everyone in safe space. So we would ask that an employee, please don't refuse temperature checks. It's non-invasive. It won't get into your space. They're actually done at a distance, and it only takes about 15 seconds to do the reading. But we want to be concerned about all of our employees and all of our citizens, and we think this is an extra step to help get us there.
Thank you. There is a follow-up question. I want to turn to Ms. Badizik on this one. With temperature checks and other matters concerning this, where will this information be stored? Who will have access to it?
This information will not be recorded on paper, nor will it be maintained. If we have an individual who has a temperature of above 100.4 degrees, they'll be referred to HR, and we will work with that employee to determine next steps.
Thank you. Our next question, when will the PRL dispenser be placed in the unit by the elevator close to communications, as well as by time clocks? Stand by, Chief Moore is coming out now.
Okay, so at the time in which the request was made for us to purchase those wall mounts, the company was on back order. So we're working with the Department of Public Works to get those items in. As soon as they come in, we will go ahead and have those put on the walls. Thank you.
All right, thanks. As we go to the next, the next question, I want to ask our next poll question. So we're closing out the current question about children and their age ranges. Our next question is also about children. So our next question will be, if your children are under the age of 18, do you have a spouse, partner, or family member that is currently providing childcare while you are at work? Again, the question, if your children are under the age of 18 years old, do you have a spouse, partner, or family member that is currently providing childcare while you are at work? A, yes, B, no, C, not relevant. That is the next question we ask you to answer. And now we will turn back to our questions. Mayor Woodfin, this question, are merit raises going to be suspended?
The answer is I'm not sure yet. You should know that's something that we are strongly considering, and here's why. I just mentioned to you right here in this hand, my left hand, number one priority is to keep you employed. With that said, I've also shared with you, we are projecting a budget shortfall. The budget shortfall has to be made up some way. And so we know that that 70 cents that goes out for our employees is made up of your base salary. It includes merit pay, it includes a cost of living adjustment, it includes longevity, it includes pension, it includes insurance. Of those things I've just mentioned, 3 are definitely in question and are up for possibly not being able to happen this year. They include merit, they include longevity, and it includes COLA. And it's not that we want to do that, it is because we have an actual budget shortfall of not being able to bring in millions of dollars into our budget. And so in that regards, I want you to consider this. If we were able to make up that money, we've already started having conversations with the Jefferson County Personnel Board, which was to say that if we were able to financially recover, will we be in a position to make our employees whole or close to whole as we could in the middle of the fiscal year, similar to bringing on a COLA, not at the beginning, but in the middle of the fiscal year? The answer, according to the Jefferson County Personnel Board rules, laws, and regulations, said no. If you don't do merit at the beginning of the year, you cannot implement or initiate merit in the middle of the fiscal year. And so, as I've stated, we won't be submitting a budget next week. For the new fiscal year that starts July 1, no budget will be submitted by then. And so there we will have continued conversations to get and assess and make better decisions on the financial strength we're in based on the data we're collecting. But we don't have enough adequate data today to assess, are we able to give a merit this year? Are we able to give a COLA this year? Are we able to give longevity this year? The main point I want you to remember is keeping you employed. That is the main thing we want to do.
Thank you, Mayor. Our next question, we're going to turn to Ms. McIsaac once again. If employees are coming back on the 18th, why will we start fingerprinting?
If this question relates to why will individuals have to continue to clock in using the biometrics, we have to keep accurate time records. It's federal law. We have tried, and if time clock does not have hand sanitizer available, please let us know. We'll make sure some is available. You should use hand sanitizer before and after clocking in each time.
Our next question, so stay close by, Ms. Madizik, but our next question, will there be reprimands against employees who are not following the face mask policy? And I think a follow-up is, will the face mask policy reprimand be disputed or debated via a hearing through HR?
So I'll take the first part, and Ms. Jill will follow up on the second part. So it's a really fair question. We're asking for employees who see that other employees are not wearing face masks or facial coverings, that you do not engage those employees. So let's start with you as an individual. If there's a personal challenge that prevents you from wearing a face mask or face covering, then we're asking for you to communicate that to your supervisor or department head, because we do recognize that there are employees that face challenges that does not allow them to wear certain types of face masks or covering. So that's for the individual. And obviously those challenges or those issues will be routed up to HR so that we can make sure that those employees are protected. If you see an employee or if you see a citizen, especially in a public space, that's not wearing a face covering or a face mask, we're asking, do not engage those employees. Please make that information known to the department head or to the supervisor, because again, they may have information on why those employees are not wearing it or why they can't. And then the employee, the director or the supervisor will then engage HR on the next steps, and then Ms. Jill will talk about what happens once it reaches HR.
If an employee refuses to wear their face mask, they are subject to discipline. We will use progressive discipline. Individuals will be given a warning, then they will move through the disciplinary hearing process. That will be done through HR. All employees need to remember that the executive order and the policy are binding upon all employees. The mayor, who is everyone's boss in the city, has given us an order to wear the face masks, and failing to do so will result in discipline.
Hold on, Howard. I asked Jill to stay up because I want to also speak to this. I'm hoping our employees are model citizens, not just to the public, but to your colleagues and coworkers as well. I understand that people may not like some of the decisions we're making, but please remember, the face cover is not about you. It's not about me, it's not about I. It is about we, us, and our. In a state of emergency, we have to have shared sacrifice. I don't want to wear it either, but we need to. Because this is not about protecting you, it's about protecting your coworker or your colleague. There are exceptions, and I hope that if one of those exceptions need to be had, we can have that conversation. But I want you to treat this no different than your uniform. If you come to work out of uniform, you're subject to the same type of discipline. Please treat the face cover accordingly. Thank you.
Will anyone forced to self-quarantine for 14 days during the early stages of COVID-19 receive their sick, not vacation time back?
The individuals who borrowed sick leave may reach out to HR to ask that their emergency sick leave be given to them so that they can get that sick or vacation time back. The emergency sick leave went into effect on April 1st. For those individuals who may have taken it between March 16th and April 1st, those will be considered on a case-by-case basis. If you do request that time back, please understand though that your emergency sick leave will then be gone. And so if you should need that emergency sick leave in the future, you will end up having to use those same hours.
All right, thank you. The next question, will the city purchase temporal thermometers?
So the answer is yes. We've already began that process. Our Chief of Operations, Chief Kevin Moore, and our operations team began moving on that several weeks ago. There was a significant back order on temporal thermometers, obviously because the demand has been high across the country. But we have a good number of them that we've already ordered. They will be back in time. And again, our ops team, kudos to our ops team for being out front on that. And they're non-invasive, so you don't have to worry about them getting too much in your space. They don't have to touch you with them. And again, it takes about 15 seconds before you get the reading.
All right, and looking at the time and also the questions in here, it looks like we are at the end of our questions. Now, we actually have a couple more coming in. But the next question, is the fire department still under SWIFT? And if so, why hasn't the police department gone under SWIFT?
The fire department has only been under swift alert. Neither the fire department nor the police department have activated SWIFT.
All right, and actually this has been touched on, but this may be somebody who joined late, so I will bring this one up. This will be our last question today, Mr. Mayor. The question is, will COVID-19 affect longevity checks, step raises, or future COLA raises for fiscal year 2021? This is our last question. Afterwards, the mayor will go into his closing comments.
Yes. The COVID-19 coronavirus has created a health crisis in our city and our community. That health crisis triggered an economic crisis, and the economic crisis will have a financial result of pain and loss of funding to the city of Birmingham. I want you all to know, I want you to hear me clearly, and I want you to believe what I'm about to tell you. Every single thing minus your base salary and your pension is on the table. My number one focus and priority is to keep you employed. I have no desire to fire anyone. I have no desire to furlough anyone. I have no desire to cut anyone's pay. All of those measures are break glass here. But everything else, traveling, supplies, educational opportunities, longevity, COLA, merit, everything is on the table because we have to find a way when 70 cents of every dollar that is spent goes to employees. If the 80 cents is not coming in, then we have to figure out a way to strike a balance of providing city services and keeping you employed. This will be a painful financial year. There won't be a lot of things to get excited about as it relates to increased fringe benefits. The priority, again, keep you employed. Please remember that other municipalities across the state and the nation are laying people off. They are firing people. They are furloughing people. They're cutting employees' pay. I don't want to do any of that. And I'm going to work really, really hard not to do any of the above. But everything else is up for grabs in order to keep you employed. I know you may not like the sound of that, but I think all of us should be grateful based on even using the example of UAB, who's not only the largest employee in the city of Birmingham, but the largest employee in the state, have furloughed people, have fired some, and others, including their president all on down, have taken pay cuts. We don't want to get to that matter. So of those things where we look to increase every year, this may be one of those years where all of us have to eat some humble pie in order for all of us to keep our jobs. Let me end by saying this. I think most of you all understand shared sacrifice. I think most of you all are appreciative that you can wake up and not only come to a job, but come to a job you love. We don't always get to have it our way, especially when things are out of our control. A health crisis creating an economic crisis, which in turn creates a financial crisis, is not anything any of us as employees want to hear when we wake up every single day, bust our butts, come to a job, and we expect to be rewarded with increased fringe benefits. I understand that pain. I want you to know we'll get through this. And this is temporary, maybe one fiscal year. This is not forever. So let's get through it together. Let's remain steadfast. Let's remember that we are public servants. And let's continue to do our jobs. And thank you so much.
Thank you, Mayor. A reminder to everybody as well, if you concerning the May day camp and any other information, whether it be executive order or any other thing that's employee facing, we have a website, a landing page, birminghamal.gov/COVID policy. That's COVIDPOLICY, birminghamal.gov/COVID policy. We have recorded this video meeting, or this virtual meeting, and we will, when available, we will load it up. It's going to be a large file, so it will take a while. Thank you so much for what you do for the city. Thank you for your service and for joining us today, and have a good day.